Well, it's the new year, and already this new year is starting to look like some of the years of recent history. Again, we are locked down, this time with the Omicron variant. The kids aren't at school here in Ontario, and the restrictions abound, again, to respond to this Omicron crisis, as some people are calling it. And again, I think this is probably a overreaction to the variant. I'm no expert on it by any means, but from what I've seen and looking at some of the data from the UK and South Africa, it seems like this variant is, although much more contagious, causes much less damage, causes much milder symptoms, and the likelihood of making people seriously ill is greatly reduced. Nonetheless, our governments here in Canada and here in Ontario in particular are locking down the population in an effort to, I guess, avoid some catastrophe that they think is coming. I personally think that the disease might be behind us fairly soon. Again, I have no idea exactly what the future brings, but from what I'm seeing in the data, I think we're all going to get Omicron if we haven't already got it within the next few weeks, and hopefully we'll have some immunization against new variants, or the Delta variant at least, and perhaps even some new coronavirus variants that might be coming. Of course, I don't know that for sure, but it seems promising that we're all going to get this, and then we're all going to have natural immunity, because the vaccines for this variant don't seem to be working very well at all. What has me concerned, though, is although the disease will be behind us soon, I believe and hope, I think some of the divisions in our society will be staying with us a while longer. I was disappointed to see our Prime Minister yesterday making some comments about unvaccinated people and insinuating that they are causing these problems or exacerbating these problems. And I'll show you the clip. And in it, he basically alleges that it's not just governments who are frustrated with the unvaccinated, but regular everyday Canadians are frustrated.
So it's not just about governments and health workers frustrated that there are Canadians who still continue to choose to not get vaccinated. It's fellow Canadians as well. When people are seeing cancer treatments and elective surgeries put off because beds are filled with people who chose not to get vaccinated, they're frustrated. When people see that we're in lockdowns or serious public health restrictions right now because the risk posed to all of us by unvaccinated people, people get angry.
Why? Well, because according to our Prime Minister, it's the unvaccinated who are taking up all the beds in the hospitals. It's the unvaccinated who are causing these lockdowns somehow. It's the unvaccinated who are putting everyone at risk. And the reporter in this particular piece certainly doesn't help the way he frames the question. I think he basically says that it's the unvaccinated who are clogging up all the ICU beds.
Wondering what you were going to do that you haven't tried already to reach these people who are continuing to clog up the ICUs.
I thought I'd just take a moment to look at some of the data here in Ontario anyway. And I admit that the Prime Minister was presumably talking about the entire country. I didn't go through each and every province, but from what I understand, the dynamics from province to province are largely similar. But I do have some data here for my province here in Ontario. And according to, this is the ontario.ca website under their COVID data, they're talking about the number of people in hospital but not in the ICU. And the way that breaks down, they divide it by fully vaccinated, unvaccinated, and partially vaccinated. Just for simplicity, I'm putting aside the partially vaccinated. I'll just exclude them from both the numerator and denominator. So if we do that, we see that it's the unvaccinated people who are making up roughly 27% of hospitalizations, not counting the ICU. So it's 27% unvaccinated, and it is 73% who are fully vaccinated in the hospital, again, outside of the ICU. Yet our Prime Minister says that it's the unvaccinated who are taking up all the beds and causing cancer patients not to be able to get their treatment. We're clearly here, 73% is a lot more than 27%. It seems that it's both the vaccinated and the unvaccinated who seem to be in the hospital. Now, looking at the ICU, I acknowledge that there's an even higher concentration of unvaccinated people in the ICU relative to vaccinated. But still, it's by no means exclusively unvaccinated. Again, putting aside the partially vaccinated for the moment, unvaccinated people, and these numbers are small, it's also worth saying that most people in Ontario who get COVID or get Omicron will not wind up in the hospital. And most of the people in Ontario that wind up in the hospital will not, thankfully, wind up in the ICU. So the chances of ending up here are fairly remote, thankfully, that these are relatively small numbers now. So in the ICU, as of today, there are 123 unvaccinated people in the ICU and about 87 fully vaccinated people in the ICU. Again, I'm ignoring the partially vaccinated. So the way that breaks down is it's 59% unvaccinated in the ICU and 41% fully vaccinated in the ICU. Now, looking at the numbers of ICU beds in total, and I noticed that these numbers don't quite add up with the pie charts. I'm guessing that they're coming from slightly different places, or, I mean, it's both, they're on the same Ontario website, but where the data comes from, I'm guessing that there's either a lag or they're not totally synced up. But I think for our purposes, they're probably close enough. So according to this chart here, this bar graph, there are 2,343 ICU beds in the province of Ontario. And of those beds, 314 are currently occupied by COVID patients, both vaccinated and unvaccinated. So by my math, that works out to about 13.4% of all the ICU beds in the province are currently being occupied by a COVID patient, whether vaccinated or unvaccinated. Now, using that same 59% unvaccinated and 41% fully vaccinated breakdown, assuming that applies to these numbers, that works out to unvaccinated people taking up just under 8% of all our ICU beds in the province, and fully vaccinated people taking up about 5.5% of all the ICU beds in Ontario. Are the unvaccinated taking up more beds than the vaccinated? Yes. Thankfully, both of these numbers are small, but it's worth noting that the number of fully vaccinated people taking up ICU beds is not zero. It's still a significant number. Yet our Prime Minister wants to make it sound as though it's the unvaccinated who are to blame for this. And it's interesting, I think what he's getting at is it sounds like, we can make a choice, or people can make a choice to get vaccinated, and it might reduce the chance of them winding up in the ICU. And I think that, again, on some technical level is true, although we're looking at very small numbers. And I don't know this for sure, but I imagine if we look at some of the people who are currently in the ICU, there's a whole bunch of people that are in the ICU, unfortunately, for non-COVID related reasons. And they're the vast majority of the people who are in the ICU. And I should say, it must be terrible to be in the ICU or to have a loved one in the ICU. That's not where we want to be. That's not where we want to have people. But I think it's important that in our society, if and when someone gets sick, that we do our best to treat them and not blame them for the choices they made before coming to the ICU. And again, I don't know this to be true, but I strongly suspect that many of the people in the ICU, whether having to do with COVID or not, vaccinated or not, probably through the course of their lives, maybe didn't always eat properly, maybe didn't always exercise as much as they could have, as is the case for all of us. Perhaps participated in some dangerous behavior. Who knows? Perhaps used recreational or illicit drugs throughout their life. Like each of us, we take different risks. Some of us ride motorcycles, some of us go rock climbing, some of us, experiment with different substances, some of us eat fatty food, some of us, it goes on and on. And I think it's dangerous to suggest that because people exercise certain choices, that Canadians should be blaming in this case, according to our Prime Minister, the unvaccinated people for being in the ICU. Would he have us blame people who are obese or who haven't looked after themselves or haven't? I hope he wouldn't. I wouldn't suggest that we do. But the logic would be the same. If we're to blame unvaccinated people for clogging up the ICU, supposedly, by that same reasoning, we should be blaming people who don't take care of themselves as well as they could. I just think this is a dangerous precedent where we're blaming a certain segment of our population. And it's also ridiculous. I mean, clearly with this Omicron variant, whether you're vaccinated or unvaccinated, it seems like you're going to get this variant. Although it might be true that those who are unvaccinated have a higher probability of having some more severe symptoms. It seems that we're all getting it. Presumably we're all passing it to one another. I don't think it's the minority of the unvaccinated people who are doing all the transmission. Yet our Prime Minister would have us believe that it's the unvaccinated that Canadians should be rightfully angry with. That this anger from regular Canadians, according to our Prime Minister, is justified because of what the unvaccinated are doing to our society. I think this disease will be behind us soon, but I worry about these deep-seated divisions and the vilification of other people that unfortunately might be with us a lot longer.